Integrated care is going to result in a step change for the support that we're able to give to unpaid carers. Beforehand, we've seen some really good programmes in general practice, we've seen some really good initiatives in hospitals, but they only touch part of the challenge for carers. And what carers really need are things to be joined up for them so that they're identified and they're recognised and they're supported better.
Here in Surrey Heartlands, we are working in partnership with social care, public health, borough and district partners, and increasingly with our voluntary sector partners.
I'm a carer support advisor and I work for Action for Carers Surrey, and I'm based at Epsom Hospital. The role is to provide a person in the hospital to support unpaid carers.
One of the things we know carers don't always do is look after their own health and well-being. So having somebody available to identify that you might have a need, to talk to you about what might be available to help you and to encourage you to ask for help yourself, I think makes a big difference.
We do this by doing something called the Surrey NHS Carers Prescription. It's a list of questions we run through. We talk about what we can provide. We can do emotional support, training, advocacy, helping with forms. We have support groups on the outside which carers can come to. So it's trying to pick carers up as early as possible so they don't face carer stress or carer breakdown, because if that happens, then you have two people coming to hospital.
When we look around the country, we see Surrey right at the forefront of that leading practice. I think what we've seen with the integrated care system is it made it possible to be more systematic, to go further and to go faster in identifying carers, supporting carers.
The way that Surrey Heartlands is working with an integrated approach across health and social care is definitely enabling us, I think, to achieve more collectively than we would have been able to do individually.
Surrey Heartlands have developed this year a carers key performance indicator. This is being applied to all our NHS contracts, and what that actually means is that we're performance monitoring all our providers against the Surrey Carers Memorandum of Understanding. It requires our providers to develop their own carers strategy, policy, guideline, and it also requires them to develop a carers action plan based on the 8 principles of the Carers Memorandum of Understanding. This integrated approach to supporting carers also allows us to reduce unwarranted variations within the system. So it's not just defined in silos of social care, healthcare, borough and district support, and voluntary sector support.
And that's actually more representative of what most patients and carers' journeys are like. They don't have a singular experience with a singular provider. Quite often it crosses over.
So working in a collaborative way, we're able to actually allow that carer's journey to be seamless.
It removes those boundaries as much as possible and allows us actually to develop a way of working that is much more about the people that we're supposed to be helping.